Innovation, access, and partnerships as India aspires to build a truly inclusive healthcare system. The future of health equity lies at the intersection of innovation, accessibility, and strong partnerships. India must reimagine healthcare delivery models that are not only cost-effective, but also equitable, ensuring that no one is left behind on the path to a healthier nation. On my panel today to talk about this very, very important issue, especially if we talk about Viksit Bharat 2047, we have Dr. N.K. Arora, Executive Director, the Inclin Trust International, Dr. Shekhar C. Mande, former DG, Council of Scientific and Industrial Research, Dr. Samir Gupta, Senior Cardiologist and Director, Metro Group of Hospitals, and Annapurna Das, General Manager, Takeda Biopharmaceuticals India Private Limited. Thank you so much all for joining us on this very important issue. And Dr. Arora, I'd like to start with you first. If you could explain to us when we talk about equitable health, what does this mean in the Indian context, and what kind of a role can technology play in this?
So, thank you very much for inviting. Equity, the true meaning of equity actually is reflected in healthcare and how, and I must also say that India's immunization program also is an example how equity can be achieved, and equity can be achieved very well. I mean, just to give an example, that today 93% of our children are fully immunized, and about 6% children who are left, particularly only 3%. Now, that is an example that every child has to be reached for immunization. And you ask, so that's how I define that anybody who requires health care has access and able to not only access, but able to utilize the services. As far as technology is concerned, I think technology is most efficient way of achieving equity in our kind of setups, which has got a very heterogeneous population groups, very diverse geographical aspects and distances. So technology will not only help us achieve equity, but two other things also come with that. Technology helps us to achieve accountability also. And the third dimension is, which was just mentioned, that technology also allows the access to those aspects of healthcare which are normally even not dreamt of. So if I want a super specialist, how do I reach somebody who is in the remote Arunachal village? So technology is the answer and is the cheapest way of quickly achieving or scaling up our equity efforts.
All right, and you know, India should be able to use technology better and better. Earlier we heard the minister also talking about, you know, AI centers that have been set up in the previous panel as well. They spoke about how AI is being used, you know, for to health even at the rural level. Annapurna Das, next question to you. And you know, we've been talking a lot about partnerships and how they can help in this journey of better health for our public. So if you could tell us more about, you know, how you know, partnerships can increase access to healthcare in India?
I think talking about equitable access, I think what's important to realize that achieving health equity is a collective responsibility. I think what it makes that as Takeda, we are forging strategic partnerships which are primarily aligned to the national priorities with the healthcare ecosystem priorities. You know, access to medicine, if is as a global pharmaceutical player, is core to our core business strategy. And we primarily work that all our medicines, vaccines are made accessible. We can broaden access to the most people who needs them the most. You know, what Dr. Arora was talking about, that people who need it the most, you know. Fundamentally, I think we work with three pillars. Number one, innovate to impact. Number two, which is sustainable access, and number three, which is health system strengthening. Now, if you look at all of these, you can blend different models of partnerships, you know, which can be cost-based partnerships, joint funding in innovation, you know, it can be manufacturing partnerships. So there are different models of partnership. One of the things that we believe is, I believe, would be very helpful is working with state governments, state health departments to increase the capacity for clinicians to diagnose but as well as treat, non-communicable diseases and vector-borne disease. I think that's fundamental, that how you can drive the kind of community. The other piece, the last piece here, is the community-centric approaches. Fundamentally, when access programs are designed with inputs from community, they are far more inclusive, they lead to better outcomes. And that's what our learning. So I'll sum up by saying that partnerships are not enablers. They are just so fundamental to drive the equitable access in a country like ours.
Well, thank you so much. You recounted about so many examples that have worked, and that's what really we need right now to show, that how things are working on the ground. And that brings us to policy. And Dr. Mande, if you could talk a bit about, how we can ensure that we have the correct policies, because what we need is more innovation. And we need innovation that will help, rural parts of the country, underserved parts of the country as well. So how can, be it state governments, be at the central level, how can we help, push for those policies that will create this innovation and technology that can give more equitable health?
Yeah, first of all, thank you for having me here. That's a very important question. If we talk of innovation, we see innovation at all levels across the country, in rural areas, in remote areas, in urban areas, in our households. Everywhere there are signs of innovation there all the time. What our mothers do essentially all day are trying to innovate on their own to make the household very livable and very pleasant. The tech-led innovation is essentially using the technologies, and a larger section of society can benefit by those. By that kind of innovation actually is what we believe would eventually drive the society forward. Now, the first sign of this we actually started seeing some years ago, when institutions such as different IITs and all took the lead and gave some space to the youngsters. For example, IIT Madras, IIT Bombay and all, they set up these technology parks and gave space to youngsters to try out their ideas in scaling up their innovations. Right? That's the key issue. The policy framework for that at that particular point of time did not exist, but soon what was followed was something like Startup India policy and things like that. They came in the last few years. Now the government's role in this is multifold in promoting innovation. Number one, government creates appropriate infrastructure for anyone to come and use. For example, government, in the very larger sense, for example, government lays down power lines, government makes roads, and things like that. But the second thing, when people want to test out their ideas for scaling up and going to an industrial scale, government actually should stay out of it. Now, one of the major policies of government to actually stay out of that, so when kids are coming out of our academic institutes, say IITs, NITs, universities, colleges, these kids are bubbling with ideas. And they actually want to try out their ideas and try to see whether these ideas can be scaled up and a larger society can benefit. And that's exactly where the government actually should step back. It should promote the early ideas by providing certain kind of funds and all, but not regulate those ideas. And
so
if our policy makes
give them a push, but not go,
that's right. Not have any
them,
extensive regulations in governing those ideas and innovations at all. So that would be actually a major role for the government to play.
All right, so that's a very interesting point that you made there. Dr. Gupta, coming to you, you're a doctor, you run a hospital as well. So if you could, we're talking about, public-private partnerships, if you could talk about examples that you've seen or where you feel, this could help in terms of, diagnostics and other hospitals as well.
Absolutely. So let me first begin by saying that, for our, the dream of our country is Viksit Bharat, right? 2047, we have to be a developed nation. And I just want to put it out there, we cannot be a wealthy nation if you're not a healthy nation. So health is of paramount importance, and I want to congratulate everyone for bringing up this panel and talking about health, which is a very neglected subject in general. Talking about public-private partnerships, it is, it's kind of an innovation in the healthcare delivery model, right? Traditionally, if you have to build up a hospital, if you want to deliver healthcare, You buy a piece of land, then you construct a hospital on top of that, and then you deliver, you put in manpower and the patients come and that's how traditionally things work. Public-private partnerships come in different flavors, right? Either the government gives you subsidized land, or they give you a pre-established hospital, which is existing, or for that matter, a diagnostic center or whatever. They give you, either they give you a land on which, at a discounted rate or a free rate, whatever, and you construct a hospital on top of that and then deliver healthcare. Or they give you a half-made hospital or a hospital which is not optimally functioning, and then you come in as a private partner and deliver healthcare over there. And then in lieu of this services that you've been given, the land or the building that you've been given, you give a discounted or free healthcare to a certain percentage of the patients who come to the hospital. So that's usually how private partnerships work.
Yes, that's how it works.
Now, public-private partnerships also play a very important role in healthcare education, right? One of the biggest challenges we face in healthcare in India is manpower. We don't either have good manpower or we don't have enough number of manpower. And, the government is now coming up with different schemes. I saw some policy work coming out of Uttar Pradesh, where the government is saying that all the district hospitals, we will convert them into medical colleges. And subsequently, we will have so many more medical colleges. The number of the patient-doctor ratio in India, which has scope for improvement, that can be increased. And the quality of that district hospital will in turn also improve, because now there is a medical college over there, there will be better doctors, there will be better staff over there, etc. So I think public-private partnership is a very important and a very key role if we have to get healthcare delivery and equity for all, as was discussed.
I'd like to come back to you, Dr. Arora. We're talking about, how we can have healthcare for all, how we can, use public-private partnerships. What are the obstacles that you see? And earlier during the sessions, we spoke about how certain doctors have, gone and worked with tribals, gone and worked in rural parts, but that is their own personal mission. How can we have more of that? What are the obstacles in, ensuring health for rural India, for tribal India?
One of the major at the moment roadblock is the shortage of manpower. And if I give you the figures, it's mind-boggling. In next 20 years or so, we are talking about 2047, we require 30 lakh more doctors. The second is nurses, about 80 lakh nurses, 50 to 80 lakh nurses and other paramedical. Therefore, the shortage is huge. Today, if I look around the whole country, every state health department has 40 to 50% deficiencies. Even medical colleges getting teachers.
As large as that?
As large as that.
Wow.
So that is something, therefore, we have to bring in innovation in terms of skilling our manpower and get them. So this is a huge area where opportunities exist. The whole concept of digital health has come in, that we are talking about Aadhaar ID. That means we have electronic health records of every individual, issues of confidentiality, issues of maintaining the data is properly used. But the most important is once Aadhaar ID and its usage is there, it should be available right up to the level of health and wellness centers, which we call Ayushman Arogya Mandis these days. So technology here is again important, that we need to have the improvement in the quality of data so that we can use.
That's a very interesting example you gave, and where there's some lacuna, and maybe there's there has to be a push for improvement there. But taking from what you spoke about AI, Ms. Das, if you could tell us how Takeda uses AI and what is the long-term plan?
Yeah, so I think from the digital technologies or AI is transforming, particularly from making it very personalized, patient-centric, and accessible. For global biopharma like Takeda, I think what we focus on integrating it across channels, okay, so that we can, whether it's for its internal and external stakeholders as well as for HCPs and patients. I think one of the things, maybe I'll quickly give you 2 examples. I think the focus is for HCP engagement and education. If you see that, I think what happens, like if AI is able to really give personalized HCP specialty and profile-based evidence to the physicians. It is also, I think, the predictive analytics that you do is able to give the progress of the disease. And as a result, the clinical decisions can be made with that help. This is one big area where we work, and we have tied up with Salesforce, I think, to bring a life science cloud-based model, which gives the AI agents and AI analytics so that the physician, there is a real-time streamlined interactions between physicians with commercial teams, with patient support teams. I think this is a major shift in how AI being used.
Right.
The other big area is, of course, patient education and patient support. I think this is what the technology plays a role. So I'll give you just one example here. It can be for faster diagnosis. It is for giving better treatment outcomes. So we are working on something, an AI-enabled app for IBD. Okay, so if you know that, which is kind of heavy, this is a disease, and this would help patients to really track their symptoms, okay? Kind of also track their relapse, help them get counseling, get them support. I think as a result of AI and technology, I think it kind of brings the provider and the patients together for that support. I think that there are multiple examples. At the end of the day, the objective is to create that faster, accessible of these treatments to the patients to improve their quality of life. You know, that's most important.
All right, and earlier on, you know, Dr. Mande, I want to come to you. We were speaking about how the burden of disease is shifting from infectious to lifestyle disease as well. So how does this affect our, you know, if we're talking about health equity agenda, how does this change, you know, impact that?
Yeah, indeed, the burden of disease is dramatically changing in the last 20 years from communicable to non-communicable or lifestyle kind of diseases. We also heard in the morning in the panel that even rural areas, this kind of scenario is changing very rapidly. Now, we have already touched upon AI, right? That's one equalizer, the democratizer of all kinds of processes. You know, so for example, when Mr. Jensen Huang was here in India 4 or 5 years ago, he gave a talk in Vigyan Bhavan, and he talked about how AI is rapidly democratizing all processes related to our common endeavor, financial markets or the trade or whatever that we talk of, and health is not very far behind. And that's one way to go forward, that how AI very quickly, we adapt AI into our healthcare system is actually our immediate goal to do that, what we should be doing. Now, Dr. Arora very rightly pointed out that most of the data that exists on different kinds of disorders is actually borrowed from the West, at the moment from India. So we don't really know the basal parameters of whom we call healthy, whom actually we say that certain kind of disorder exists in that person. And that kind of data needs to be generated in India very, very rapidly. And wherever data that exists on today's date is on different formats in different places, so it cannot be integrated that very easily. And if we were to develop our own AI models or large language models or something based on this particular data, it should be our urgent necessity to actually get all these data accessible to our AI community, make it accessible, make it uniform, and make sure that this data can be used very meaningfully for the future of the healthcare.
All right, and clearly there is a need, and for this, we're a young country. We have such a, you know, a burgeoning young population. Hopefully they can be encouraged to think on these lines of innovation. We all talk about startups. Dr. Gupta, anything you'd like to add to that, and where you feel, you know, we need more innovations and how they could help in this Viksit Bharat 2047?
Absolutely. So, you know, we were talking about AI, so I'll just talk two minutes about that. You know, AI is the buzzword, right? Like Sir just said, that, you know, from trading to everything else, AI is being, so I think.
So we don't want people to go to AI for their consultancy as well. Like, there's a lot of misinformation also.
Absolutely. So I think AI is what you feed in is what you get out.
Yes.
And that's how AI works. And that's what Sir said, that, what the data that is required to train those models is very important. But, with the various initiatives of our country of getting Abha ID and all the other the digital health missions, hopefully this will all be successful and we'll have a lot of data that can be fed into for predictive analytics, right? Previously, if you think how the car would function, right? Previously, 20 years ago, you would have a car and you would take it for servicing when it would go bad. Then they started coming out with data. You know what? Every 1,000 kilometers, go get the tire pressure checked. Every X amount of kilometers, get the engine oil changed. So prediction started coming into the picture from data. So similarly, can we reach a stage where we can predict that this person has X, Y, and Z things? Can we predict that this guy is going to get this X illness? So can we do something to prevent that illness from happening before it has happened?
Preventive health, what we were talking about
Preventive
earlier,
health.
yes.
And, AI, I don't think is going to, in healthcare per se, which is so sensitive, so important, I don't foresee it taking away jobs. I see it as your co-pilot. Like when you're driving a plane, there is an autopilot, there is a pilot, and then there is a co-pilot. I think AI is going to be your co-pilot. And I'll give you a small example. I'm a cardiologist, right? So I'm doing angiographies, angioplasties, and all those things. And that there is this technology we use called OCT, which is for improving your imaging during the procedure. And we would do that imaging first, and whatever data, the images that would come out, you would analyze it yourself, and you would make treatment recommendations. And that analysis would take a couple of minutes. So, this technology AI is going to be your co-pilot in your journey of treating patients.
All right, that's very interesting. So nothing to be, scared of. It's how we use it really and use it to benefit our people. Thank you so much. We're out of time. Thank you so much for joining us on this panel and talking about this, about a Viksit 2047, equitable health for all. Hopefully that dream can actually come true. Thank you.